They will meet in the midline like this. An embryo is implanted into the uterus. So you see that a part of yolk sac cavity, it becomes. Hello, I am Dr. Aizaz from MedicoVisual.com, and in today's visual lecture, we will talk about the embryonic folding. Now, the people who are already watching my videos on MedicoVisual, this topic is not new for you. I have discussed the concepts related with embryonic folding in several different videos. For example, I have discussed it briefly in the video about the development of Allantois, then in the body cavities embryology videos, and in GIT videos, in first video of head and neck course, and several other videos. But this topic was scattered in among different other related topics. So the goal of today's visual lecture is to organize the concept of embryonic folding in a single video. So I will start from the very basic and simplified approach first, and then we will go to a bit more complicated concept related with embryonic folding. So in this simplified 3D model, what you can see is that there is this trilaminar germ disc. So at the end of third week of development, we have this trilaminar germ disc, and it consists of, trilaminar means three layered. So it consists of three layers. What are those three layers? This one, which is actually, this is basically the dorsal side. But conventionally, in the textbooks, you will always see that dorsal side is almost always drawn upwards, and then this is the ventral side, and it is drawn, or it is depicted downward side, right? So this is dorsal side, and here is the ectoderm, and towards the ventral side, this yellowish one is the endoderm. And of course, in between the ectoderm and endoderm, in between them, this greenish one is mesoderm. But of course, mesoderm is not such homogeneous structure as being shown in this 3D model. But for the sake of simplicity in this animation, I will show you the mesoderm. I will show you the embryonic folding with this simplified model first. So, what actually happens in embryonic folding? Two types of folding mainly occur. That one is the craniocaudal folding. Actually, you can consider it as three foldings, but craniocaudal, cranial as well as caudal folding, they are often considered together. So, we can simply call it craniocaudal folding. So, in cranial folding, this part will move ventrally like this, and in caudal folding, this inferior end or caudal end will move ventrally like this. So this is cranial folding, this is caudal folding. So craniocaudal folding. And then if we talk about the transverse folding, the other folding is, so one is cranio craniocaudal folding, the other is transverse folding. It is also called uh, lateral folding, transverse folding or lateral folding. So in transverse or lateral folding, these lateral margins of the embryo here, one side is being shown and of course the other side as well, they will move ventrally, similar to craniocaudal folding. They will move ventrally and then they will meet in the midline. So that's how this folding occur, and I will show you the animation to make these things very clear in your mind. So this is the craniocaudal folding. Now one thing that you must keep in your mind, that both of these types of folding, they typically occur, they are going on side by side, they are occurring concurrently or simultaneously, right? But for the sake of our ease of understanding and for the sake of demonstration purposes, we do not take them together. We first explain one of the type of folding, for example, craniocaudal folding, and then we take up the transverse folding. The sequence doesn't really matter, it is just for demonstration purposes. But in reality, keep this in your mind that this process is going on concurrently, it is happening simultaneously. Right, so first let's understand the transverse folding, that these lateral folds, not folds, lateral ends here, these lateral sides, they will meet, they will come closer in the medially in the ventral side, on the ventral side, and then they will meet in the midline like this. So this is the transverse folding. And then, of course, there will be cranial as well as caudal folding, where the cranial and caudal ends, they will come to meet ventrally and again in the midline. And ultimately, these parts, they will seal off, they will meet together, they will be sealed, and that's how this is the final structure of the embryo after the folding. Now, of course, before the folding, it was just the three discs. It nowhere resembled a baby, but even now it does not resemble a baby. But of course, later the limb buds will appear, so limb buds will appear like this, and then it will begin to resemble more like a baby, right? And that's how the folding occur. Now, as a result of folding, the ectoderm has become the outermost structure, and endoderm has become the innermost structure, and mesoderm is in between. So let me show you this concept. So basically, we have nested cylinders arrangement after the embryonic folding. The outermost cylinder is the ectoderm, which is outermost cylinder, and it is mainly the transverse folding which led to this orientation of the embryo. So outermost is ectoderm, then innermost is another cylinder which is endoderm. Of course, it will be relatively narrower cylinder. This is endoderm, and in between the two, we will have our mesoderm. Actually, colors are a bit off in this. Sorry about that. But anyhow, in between them, we will have this one is the mesoderm. So we have three cylinders. The outermost is ectoderm, innermost is endoderm, and midway we have mesoderm. So that that's how these structures, they will form different organs or different tissues of our body. For example, the superficial component of our skin, the epidermis, it will be found by ectoderm. The deeper viscera, the respiratory system, the GIT system, so these systems, they that will be found by endoderm, and then in between them the connective tissue, the muscles, and some other structures, those will be found by mesoderms. Of course, the some viscera of our body, some other organs of our body, they are also found by the ectoderm. For example, if we talk about the ears, the eyes, they also develop from the ectoderm, but that I will not discuss in this lecture. So basic orientation and basic plan of our body is established due to this embryonic folding. But things are not that simple. Things are not always that simple in our life. Sometimes nature love complexity, so the folding process is not that simple. There are some other factors that are here. There are other related structures that we must discuss when we talk about folding. For example, we should not forget the cavities that surround the embryo. For example, the amniotic cavity, the extraembryonic cavity, extraembryonic coelom, and we must also discuss the umbilical vesicle or yolk sac cavity. And along with that, we will also discuss what happens to different structures. What is first we will discuss what is the orientation of structures before the embryonic folding, and then we will discuss what happens to different structures after the folding has been concluded. And for that, I will go to another 3D model. So here let's suppose that an embryo is implanted into the uterus. So you can see this greenish embryo implanted into the uterus. And now, for the sake of understanding, let's remove the uterus and let's remove the outer covering, the trophoblastic covering. Then we will see this structure, this greenish outermost covering would be the extraembryonic somatic mesoderm. So if we cut this mesoderm like this, if we take a section, let me show you what I actually did here. That if I take a section, this cross section like this, that I have cut it from here, sort of like this. So I have taken this section here. So if I take the section, then you will see these structures here. So these are the structures. And this one is, let me first orient you about the directions. So this one is cranial or anterior side. This one is caudal. And this one is dorsal. And this one is ventral side. Now, what are all these structures? As I've told you, this outermost layer, the outermost layer is extraembryonic somatic mesoderm. Extraembryonic somatic mesoderm. And then it continues and continues. And then here we have this connecting stalk. Connecting stalk. Now, this extraembryonic somatic mesoderm from connecting stalk, it is continuous outside the amniotic cavity. Right, so basically this bluish one, this bluish one is amniotic cavity. Amniotic cavity is lined by this membrane, amniotic cavity membrane, and outside the amniotic cavity membrane, this is also the extraembryonic somatic mesoderm. So we have extraembryonic somatic mesoderm outside here, and then there is this extraembryonic somatic mesoderm which is also lining the amniotic cavity as well. So, and of course, in between them, this cavity, this one, this cavity is extraembryonic coelom. And then we have this one. What is this structure? This one is called, this is another cavity which is called yolk sac cavity. Now, if you are confused about all these structures, you do not understand anything about these structures, you need to have some basic idea about the first week, second week, and third week of development. During these weeks of development, these structures, they gradually appear in the embryo. And in this lecture, I will not go into details of how these structures form. Please watch those lectures to understand these basic concepts. So anyhow, let's move forward. We have these three cavities, extraembryonic coelom, and then amniotic cavity and yolk sac cavity. Then we have again these structures that I have already described. This one is ectoderm. Then below, or actually to be precise, ventral most is endoderm. So this is ectoderm and this is endoderm. And in between there would be mesoderm, but it is not clearly visible in this section. So here we have the, what is this, neural tube here, developing neural tube, and then we have notochord here. I hope you are very clear about these structures. A few more structures that I would like to highlight here. First, here at the caudal end, you can see that there is this outgrowth. Please don't tell anyone that this is the penis of the baby. It's not the penis of the embryo. It is called Allantois. This outgrowth that develops from the yolk sac cavity, it is called Allantois, and it has some role in development of urinary bladder. What is that role? I will not go into that. You have to watch the lectures on Allantois as well as the genital embryology course. You can watch that as well. So this structure that I wanted to highlight, plus you can see that here ectoderm, you see ectoderm, going like this, depressed here, and here endoderm going like this, right? Here as well. So at these two places, the ectoderm and endoderm, they are closely packed together. They are closely, rather, I should say, they are closely stitched together with little to no mesoderm between them. So what are these two areas? These points are called, the cranial one is the oropharyngeal membrane, oropharyngeal oropharyngeal membrane, and at the caudal end we have cloacal membrane. I know this model seems a bit off. I think ideally the cranial side should have been shown here and caudal should have been shown here, but anyhow that's how it is. I mistakenly made the things like that, and I was too lazy to change the stuff up. It's not about being lazy, it will take a lot of time, and I don't want to waste the time. So, anyhow, these are the two membranes. So, this is the arrangement. Oh, yeah, and other important structure that I totally missed here. That's very important here. What is this? You can see this structure here. So, this structure is called septum transversum. So basically, okay, let me go a little deeper here to show you what I am talking about. So you see, outside is extraembryonic coelom, but actually we also have an intraembryonic coelom. If I go here you can see that uh, we have this mesoderm, and here we have between these two layers of mesoderm. Okay, let me first draw a side diagram, otherwise it will be very difficult for you to understand. So, in the simplified depiction, I have shown you that this is ectoderm, then we have mesoderm, and then we have, what is this? Endoderm. But of course, things are not that much simpler. If we take a section like this, if we cut it from here like this, the other section, then what you will see is that the dorsal most is ectoderm. Then we will have, in the center, we will have neural tube, and then we will also have notochord. And then if we talk about mesoderm, it is not a homogeneous structure. It consists of this structure. This is called paraxial mesoderm. Then we have intermediate mesoderm, and then mesoderm splits into two parts. These both mesoderm, they are at lateral end, they are lateral plate mesoderm, and they have two parts. The upper one is intraembryonic somatic mesoderm, and lower one is intraembryonic. This is not extraembryonic now. So intraembryonic somatic mesoderm, and this is intraembryonic subplanchnic mesoderm. So here it will, here is the amniotic cavity is being formed. So it will continue with extraembryonic somatic mesoderm. Here as well, intraembryonic somatic mesoderm will continue with extraembryonic somatic mesoderm. And then we have intraembryonic subplanchnoploric or subplanchnic mesoderm, and below that will be the endoderm, and then it will continue with yolk sac cavity. So this layer will also intraembryonic subplanchnic mesoderm. It will also continue with extraembryonic subplanchnic mesoderm. Now outside it will be again the extraembryonic somatic mesoderm, and in between there will be this extraembryonic coelom. But then we have intraembryonic coelom as well, and this structure here, not structure, this specific cavity here is the intraembryonic coelom. So now if I go to this 3D model, here you can see that we have the intraembryonic, this one is intraembryonic somatic mesoderm, hold this one. It continues with extraembryonic somatic mesoderm, hold this one is extraembryonic somatic mesoderm. And then here this one is intraembryonic subplanchnic mesoderm, and it continues with extraembryonic subplanchnic mesoderm, and in between them, this cavity is intraembryonic coelom, and it laterally continues with extraembryonic coelom. So I hope now you are clear about these things. And here this red structure is actually the horseshoe shaped which tube, heart tube, that is being formed here. So this is horseshoe shaped heart tube. So that's how these structures are depicted. But what is this block of mesodermal tissue? So this block of mesodermal tissue is called septum transversum. I will not go into details of how it forms in this lecture, but please understand that it either develops from the intraembryonic subplanchnic mesoderm, or it develops from the undifferentiated lateral plate mesoderm. I have discussed it in more detail in some other lecture. I think I have discussed it in body cavities embryology lectures. So anyhow, by the way, its function is that it has some role in development of diaphragm as well as liver. So now our focus should be, now we will first understand the craniocaudal folding, and now our focus should be that what happens to all these structures after the folding. Before the folding, you can clearly see that all these structures, they are lying on the same plane, right? So if we draw a plane here, you see all these structures, they are lying on the same flat plane, right? So obviously, when the craniocaudal folding occurs, they will move ventrally, so their plane will shift, their orientation will change. So let's see, rather than me explaining that this will happen and this will happen and that would be pure yapping blah blah. So I am actually going to show you visually that what is going to happen. So let's watch the animation first. Wow, it's incredible, isn't it? Let's watch it again. I love showing this animation. That's a beautiful mechanism of nature. So, you see that before folding, the what are these structure, oropharyngeal as well as cloacal membrane, they were lying dorsally on the same plane as this part of the ectoderm, but now after the folding they have come to life ventrally. The heart tube, its position has also changed, right? I hope you can see if I isolate it for you. So that's how the position of heart tube has also changed. And then most importantly, what happened with endoderm, this is I think most important part of this orientation thing, right? And of course, Allantois, it has also come ventrally, you see. And Allantois, it remains, by the way, in the connecting stalk. So now you can understand that what actually happened here. Let's draw a diagram on side to make you understand these things. So first, the if we talk about endoderm only, it was a flat structure. But after the folding, these ends, this end and this end, they came ventrally and they formed a structure like this. And it was continuous with what is this yolk sac cavity. So some part of yolk sac cavity, it 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 got engulfed here. It became a part of this structure, right? So actually, with this orientation, I'm going to give it a more 3D touch. So with this orientation, you can see that it has formed basically three parts. This part will form, this part here, this will form foregut. It is actually foregut. And then this part is hindgut. This is foregut, this is hindgut. And here this part which is still continuous with the yolk sac cavity, it is the midgut. And this connection of this midgut with the yolk sac cavity, it is called omphaloenteric duct or vitelline ducts. Let me write it here. Omphalo. I am not good with spelling, so I am writing it like this. Omphaloenteric duct or vitelline duct. So here you can see that this one is uh, actually it's other way around. This one is the cranial side. Don't forget cranial side. So this is foregut. This is foregut. I think I need to use some other color. So this one is foregut. Foregut. This one is hindgut. So you see Allantois is here. So a hindgut, and then in between this one is midgut. Of course, here I am assuming that this one is cranial side, so that don't get confused, and this one is caudal. Of course, it depends upon how you are looking at these structures. If we had taken a section from the other side and we were looking from here, then of course the cranial and caudal side would have switched. By the way, how this folding occurs, it is believed that as the cranial folding, especially as the cranial folding, it occurs because the these neural tubes, the cranial end of this neural tube, it grows and it forms different brain swellings, and that leads to the arrangement like this. But I'm not sure how exactly it happens at the caudal end. So yeah, this is the situation. So now if we focus on the cranial end, you can see the oropharyngeal membrane, it has also come to lie. It has also come to lie ventrally. And here you can see this heart tube is here. And ventral to heart tube, this part of intraembryonic coelom, it is going to form what? It is going to form the pericardial cavity. So the future pericardial cavity lies ventral to developing heart, and we have septum transversum here. So septum transversum is right here, near, almost near the junction of foregut and midgut. And here it will form different structures related with diaphragm, and it will help in formation of liver, that I will not go in detail in this lecture. So one thing that I would like to discuss here, that this is oropharyngeal membrane. This one is oropharyngeal membrane. But what is stomodium? Actually, this oropharyngeal membrane is the primordium of mouth. And if we focus only on the ectoderm, so this one is the ectoderm. From the ectoderm side, if we are looking for, if we are standing here, let's suppose, and if we were to look at the ectodermal side, what you will see is that there is a depression here. Of course, you cannot look at the endoderm from here. You cannot see the endoderm here. Later, of course, it will degenerate and you will see an opening here. But right now, you are only seeing a depression. So if you are standing here and you are looking from the outside towards the ectoderm, and from this ectodermal perspective, you are seeing this ectodermal depression, then this depression is called stomodium, and it is said that this stomodium is actually the primordium of mouth. And this membrane here, this is called oropharyngeal membrane. So this membrane actually will rupture here, and here this opening of mouth will be formed. So these are two related but different structures, stomodium versus oropharyngeal membrane. Do not mix these things up. Some students get confused. Please understand again that it is ectodermal depression. The stomodium is ectodermal depression, but oropharyngeal membrane is bilayered membrane which consists of ectoderm and endoderm, and little to no mesoderm in between them, right? So please understand this thing. So yeah, this is the orientation after the craniocaudal folding. We talked about cranial folding, but caudal folding is also very easy to understand, and it's very logical that cloacal membrane, it has also come to lie ventrally, Then the Allantois, it has also come to life ventrally, and connecting stalk. This one is the connecting stalk. It has also come to life ventrally. So that was all about craniocaudal folding. But if we see the transverse folding, to understand the transverse folding, I will have to uncut this embryo. So we have uncut this embryo like this. And of course, in the cranial folding, these lateral ends of the embryo, they will come to life ventrally like this. I know it's hard to understand, so I will take another section from here like this, and then we will observe. So here the transverse folding or lateral folding has had already occurred, so let's move back. So now the folding has not yet occurred, and here you can also view the heart tube as well. So I'm sorry, I'm having a bit of flu and sore throat, so my voice might be affected. Please bear with me. I still have to record the lecture. So anyhow, that's the part of life. So again, you can see the mesoderm more clearly in this model. The central one is paraxial mesoderm, and we have this intermediate mesoderm here, and then lateral plate mesoderm, intraembryonic somatic mesoderm, continuing with the extraembryonic somatic mesoderm, and intraembryonic subplanchnic mesoderm here as well as here, continuing with the extraembryonic subplanchnic mesoderm. Now, as the transverse folding occurs, you see that a part of yolk sac cavity, it becomes the part of midgut. You see, it's beautiful, right? So here you can see all these structures. With these animations, I think I don't even need to speak. You can just watch these animations and you will be able to understand it. And there is almost no need for me to speak here. That's the beauty of visual learning. And by the way, what happens to heart tube? This heart tube, which was initially, horseshoe shaped, it changed its structure. Its limbs, they also met in the midline like this, and ultimately the heart tube fused and formed a single heart tube. Even before the folding, actually, it was a single heart tube. Let me explain what I mean by this. So initially, the heart tube was like this. Then after the craniocaudal folding, let me draw like this craniocaudal folding, it changed the shape like this. And ultimately, these limbs, they also fused together. So they all fused together to form a single larger heart tube. If you want to understand these things in more clearly in more detail, please watch the lecture on development of heart. The first lecture on development of heart. It's available for free on the YouTube channel. So this is about the heart tube. Now you can see this one is the intraembryonic coelom. Let me show you. So this one is intraembryonic coelom, this one also, and this one is extraembryonic coelom. So near this area, near this midgut area, here there is still a connection between intraembryonic coelom and extraembryonic coelom. So ultimately they will meet and ultimately this connection will be lost, but this connection remains for some time. And by the way, this part here, it will close and it will form a proper embryo. So I think that was all. And by the way, this narrow connection here, okay, let me show you this narrow connection here. This is omphaloenteric duct or vitelline duct. Vitelline duct. So yeah, that was all about the craniocaudal and transverse folding. One more thing at the end that I would like to discuss. Now, this is not directly related with folding, but it's an important concept that many students they get confused about. So actually, you see amniotic cavity is here, then we have this outer one is extra embryonic coelom. So later in development, what actually happens that amniotic cavity grows quite a lot, and before that also what actually happens that the yolk sac cavity, it also obliterates quite a lot. So it becomes very small like this. So here we have this yolk sac remnant here. Both views I am showing. So then the amniotic cavity, it grows quite a lot, that the embryo, it is now completely, almost completely surrounded by the amniotic cavity. And here you can see this structure is actually your umbilical cord. It seems to be very wide, but later it becomes relatively much narrower. So it consists of initially this remnant of yolk sac cavity, and then we have allantois here, and we have this part of connecting stalk that is making up this umbilical cord. So I think that was all about the embryonic folding. Thank you so much for watching this video. Have a great day. Goodbye.